Have you ever wondered how high blood pressure could potentially affect your vision? Well, let's dive into this fascinating topic. When we think about blood pressure, we often associate it with heart health, strokes, or kidney diseases. But it doesn't stop there. Our blood pressure has a far-reaching influence on our bodies, and that includes our eyesight. You see, every part of our body requires a stable supply of blood, and our eyes are no exception. Our eyes, intricate and delicate, need precise blood pressure to function correctly. The blood vessels in our eyes, much like those in the rest of our body, are sensitive to changes in blood pressure. Imagine a garden hose. When the water pressure is just right, it waters the plants evenly, keeping them healthy. However, if the pressure is too high, it could damage the plants. Similarly, when our blood pressure is too high, it can potentially harm the delicate structures of our eyes. Now you might be wondering, what does this mean for our vision? Well, chronic high blood pressure, also known as hypertension, can lead to several eye problems. These include hypertensive retinopathy, choroidopathy, and optic neuropathy, which can all result in impaired vision or even vision loss. In hypertensive retinopathy, for instance, the high pressure damages the blood vessels in the retina, the part of the eye that converts light into signals sent to the brain. This damage can lead to blurry vision or even complete loss of sight. But it's not all doom and gloom. The good news is that maintaining a healthy blood pressure can help prevent these issues. Regular checkups, a balanced diet, regular exercise, and medication when needed can all contribute to keeping your blood pressure in check and your vision sharp. So you see, the relationship between your vision and blood pressure is more significant than you might have imagined. This is just the tip of the iceberg. As we delve deeper, we'll uncover more about the science behind this interplay and the preventive measures we can take to safeguard our health and vision. But how exactly does high blood pressure affect our eyes? Let's delve into the science behind it. To understand this, we first need to comprehend the basic anatomy of the eye. Think of your eye as a miniature camera, capturing and processing images. The retina, located at the back of the eye, is the film of this camera. It's rich in blood vessels and is responsible for converting light into electrical signals that the brain interprets as images. Now, these blood vessels play a pivotal role in maintaining the health of the retina. They provide the retina with essential nutrients and oxygen, thus ensuring its optimal function. But what happens when these blood vessels are put under undue pressure? This is where high blood pressure or hypertension comes into play. It exerts excessive force on the walls of blood vessels throughout the body, including those in the retina. This pressure can cause the blood vessels to harden, narrow, or even rupture. When the blood vessels in the retina are damaged, a condition called hypertensive retinopathy can occur. This condition can lead to blurred vision or even complete loss of sight. Moreover, high blood pressure can also lead to optic neuropathy, a condition where the flow of blood to the optic nerve is blocked, causing nerve damage and vision loss. Additionally, high blood pressure is a risk factor for other serious eye conditions such as glaucoma and age-related macular degeneration. In glaucoma, the increased pressure can damage the optic nerve, while in macular degeneration, it can lead to the breakdown of the central part of the retina, known as the macula. In a nutshell, high blood pressure can exert a domino effect on your eye health, starting with the blood vessels and potentially leading to various vision problems. It underscores the importance of maintaining a healthy blood pressure level for not just your heart health, but your vision too. Remember, if the heart is the engine, the blood vessels are the fuel lines, and any pressure in these lines can cause serious damage. Now that we understand the science, what are the consequences of high blood pressure on vision? High blood pressure, if left unchecked, can lead to several vision problems. Let's delve into some of these conditions. First up is hypertensive retinopathy. This condition occurs when high blood pressure damages the blood vessels in the retina, the part of the eye that processes light and helps us see clearly. The symptoms can be subtle, with people often not realizing anything is wrong until their vision becomes impaired. Some may notice a gradual blurring or loss of vision, or even sudden blindness in severe cases. Next, we have choroidopathy. This is a serious condition where fluid builds up under the retina because of a leaky blood vessel in the layer of blood vessels in the choroid. When this happens, it can distort vision or sometimes lead to patches of vision loss. People with choroidopathy may experience visual distortions such as seeing objects as smaller or larger than they are, or they might see a dark, shadowy area in their central vision. Finally, there's optic neuropathy, a condition that results from damage to the optic nerve, which transmits visual information from the eye to the brain. This can lead to bleeding within the eye or vision loss, and in severe cases, it can cause irreversible blindness. Symptoms can vary, but often include a reduction in the field of vision, difficulty seeing in low light, and a loss of color perception. These conditions are not to be taken lightly. They can significantly impact a person's quality of life, limiting their ability to perform everyday tasks and enjoy the world around them. They're also a reminder of how interconnected our body systems are. High blood pressure doesn't just affect the heart, it can also have a profound effect on our vision. As you can see, untreated high blood pressure can lead to a variety of serious vision problems. So it's crucial to keep an eye on your blood pressure and take steps to manage it for the sake of your heart and your eyes. So, what can you do to prevent high blood pressure and protect your vision? Well, there are several ways, but it all starts with lifestyle changes. The power to guard your vision against high blood pressure lies in your hands, and it's easier than you might think. Firstly, your diet plays a significant role. Opt for a diet rich in fruits, vegetables, lean proteins, and whole grains. These foods are low in sodium and high in potassium, both of which are essential in maintaining a healthy blood pressure level. Don't forget to limit your intake of processed foods and saturated fats, as they can lead to weight gain and increased blood pressure. In addition to a balanced diet, regular physical activity is also crucial. It doesn't necessarily mean you have to hit the gym every day. Simple activities like walking, cycling, or even dancing can make a big difference. Aim for at least 30 minutes of moderate exercise most days of the week. It not only helps lower your blood pressure, but also strengthens your heart and boosts your overall health. Another key aspect is limiting alcohol consumption and quitting smoking. Both can raise your blood pressure and increase your risk of developing other health complications. Stress management is equally important. High levels of stress can contribute to high blood pressure. So, find effective ways to manage your stress, be it through meditation, yoga, or simply taking time for yourself. Lastly, don't underestimate the importance of regular medical checkups. Regular screenings can help detect high blood pressure early and allow for timely intervention. If you are diagnosed with high blood pressure, your doctor will likely recommend a combination of lifestyle modifications and medication to help manage it. Make these changes not just for your vision, but for your overall health. It's a journey, and every step you take is a step towards a healthier you. Remember, prevention is always better than cure, especially when it comes to your vision and overall health. Before we wrap up, let's quickly recap what we've learned today. The interplay between vision and blood pressure is a complex one, with each influencing the other in ways that can be both beneficial and detrimental. We've seen how high blood pressure or hypertension can have a profound impact on the health of our eyes and the quality of our vision. The science behind this relationship is fascinating. Blood pressure is the force that blood exerts on the walls of our arteries as it travels through our bodies. When this pressure becomes too high, it can cause damage to the delicate structures within our eyes, including the retina and the optic nerve. These structures are vital for vision, and damage to them can lead to serious vision problems. We've also discussed the potential consequences of high blood pressure on vision. These can range from minor visual disturbances to severe conditions like retinopathy, optic neuropathy, and even blindness. It's clear that high blood pressure is not just a heart issue, it's a vision issue too. But the good news is, there's plenty we can do to protect our eyes from the damaging effects of high blood pressure. We've explored some of the ways to prevent and manage high blood pressure, from making healthy lifestyle choices like eating a balanced diet and getting regular exercise, to taking prescribed medications as directed by healthcare professionals. It's important to remember that monitoring our blood pressure regularly is key to maintaining both our heart health and our eye health. Regular eye exams are also crucial, as they can detect early signs of damage before vision loss occurs. So, what's the takeaway? High blood pressure and vision health are deeply intertwined. Taking steps to manage our blood pressure can help protect our vision, and by caring for our eyes, we're also caring for our overall health. Remember, your vision is a precious gift. Don't let high blood pressure rob you of it. Stay healthy, stay vigilant.